I'm Professor Adam Winstock. I'm a consultant psychiatrist, addiction medicine specialist, and founder of the Global Drug Survey. In this video, I want to talk to you about fetal alcohol syndrome, or more accurately, fetal alcohol spectrum disorder. Alcohol is the leading cause of avoidable mental retardation in the world, and most governments around the world give the advice that there is no safe limit for alcohol in pregnancy. And all the evidence says that's true. Even consumption at 1 or 2 units a day has been linked to low birth weight and prematurity. Fetal alcohol spectrum disorder, though, is something else. And I want to talk to you a little bit about why it's so important not to drink during pregnancy. So, alcohol crosses the placenta. That means every time you drink alcohol, it goes to your baby. Now, your baby's brain is this kind of like beautiful developing organ, and it needs to develop really free from as many chemicals that are going to affect its kind of development. And what we know is that alcohol, particularly high alcohol intake in the first trimester, can have a profound effect upon fetal development. What we also know is that excessive alcohol use during pregnancy often sits not in isolation. Very often, mothers who are drinking too much may have other problems. There may be societal problems, there may be domestic violence, there may be poor diet, there may be poverty, there may be poor access to antenatal care. So very often alcohol is just one of a number of factors that's making it very difficult for a pregnant mother to stop drinking. Now, within our society, pregnancy is this revered state, and therefore women feel under a lot of pressure if they're drinking to hide that because of issues of stigma and shame. In fact, if you're thinking about getting pregnant, the best thing to do to increase your risk of falling pregnant is actually to reduce your consumption prior to conceiving. But if you're someone who gets seen in the antenatal clinic, I think being honest around your alcohol use is really important, but also understanding that there are other factors here at play. So some of the important things I think people need to know about the link between alcohol and fetal alcohol disorder are: 1, binge drinking is worse than regular low-level drinking. 2, older mothers seem to be more sensitive to kind of fetal alcohol syndrome than younger mothers. Women who have had more children seem to be at greater risk than people who have had no children in the past. Alcohol plus other drugs are clearly going to be more of a problem, particularly tobacco, which through the whole of pregnancy can cause huge problems. But I think it's also important that it's not just that first trimester. Alcohol consumption at any point during pregnancy has been shown to impact negatively on fetal development. Now, I think the most obvious kind of outcomes of alcohol consumption during pregnancy are basically low birth weight, intrauterine growth retardation, so having a smaller baby, and prematurity. It can also be associated with miscarriage as well. But fetal alcohol syndrome is a much more specific constellation of craniofacial malformations, which I know is a really big medical word, which basically means that some children are born with abnormal faces, which can mean a small chin, low set ears, no upper lip, a flat philtrum, a small nose, epicanthic folds. These kind of very characteristic pictures can be very difficult to spot in a newborn baby, but as children get older, these features can become more obvious. You can also get skeletal abnormalities. You can get deformity in most of your organs, whether it's your kind of kidneys or your heart. And as children develop, the impact of fetal alcohol can become more obvious by higher rates of learning disability, so slower neurodevelopmental delay. It might be the child is poorly coordinated, slow to walk or talk, may have behavioural problems or difficulty concentrating. And in fact, actually throughout that child's life, the consequences of drinking through pregnancy can become increasingly marked. And I guess that there's no one who wants to fall pregnant and give birth to anyone other than a really healthy child. And so I think that for mothers out there who are drinking, then the advice from every single government is you want to be drinking nothing at all. There isn't a safe limit. So I think that if you're interested in conceiving and falling pregnant, I think it's worth addressing your alcohol problem before you try and conceive, because trying to do it while you're pregnant is a huge challenge, because pregnancy is such a difficult time. And also detoxing someone when they're pregnant can also be really risky because of the risk of people having seizures. So as much as possible, what we want is people to be non-drinkers before they fall pregnant. And this is really just what all the evidence says. I'd love to say there's a safe level of drinking, but there isn't. I'd love to say that it doesn't make any difference, but it does. So if you want to provide the healthiest, happiest womb environment for your growing child, that's got to be an environment that's got no alcohol, really not smoking, and having kind of a healthy, happy diet. Making sure you attend your antenatal classes, making sure home environment and you are as supportive as possible. That way you've got the best chance of having a happy, healthy baby, and that's what we all want.